Chapter 4, Nursing Process and Critical Thinking. And these are the remaining objectives for this chapter. So the nursing process it's basically a systematic way uh, for nurses to be able to explore the patient's health problems or their health status. And so you can identify actual or potential healthcare problems the patient may be experiencing, determine the desired outcomes that you're looking for, deliver specific nursing interventions that will help solve the problems that you've identified and promote the patient's health, as well as evaluate their caregiving that you've provided and determine whether the outcomes have been achieved. And so it's a 5 phase process that includes assessment, a nursing diagnosis, planning, implementation, and evaluation. So, like I said, these are the 5 phases of it: assessment, nursing diagnosis, planning, implementation, and evaluation. There's actually a table in your book, box 4.1, on page uh, 51 that goes through each of them, and we'll go through each of these in detail in the coming chapters here. Um, but you can see under assessment piece of it, you might see where it says a RN function, but the LPN definitely contributes in this area by collecting data. So you'll be a part of this in collecting data. However, the nursing diagnosis piece is the sole responsibility of the registered nurse. So as the LPN, you might not see that piece. However, you should understand about the nursing diagnosis and how it's created, because if you were to have a patient and some new things develop with your patient, you need to be able to go to your registered nurse and say, hey, I think you need to assess the patient for XYZ. They may need a possible nursing diagnosis added to their care plan. So you need to be able to understand that. But the sole responsibility of creating and identifying that nursing diagnosis will be that of the registered nurse. The LPN will not do that. So a lot of people remember um, this process with uh, a simple uh, acronym ADPIE, ADPIE. So ADPIE, assessment, diagnosis, planning, implementation, and evaluation, to try to help you remember the steps in the nursing process. So this is going to be very critical, especially when we um, start prioritizing things, learning how to prioritize, because assessment should always be the first thing we want to do for our patient. Um, Unless they're, in some type of distress or something like that, then we need to, do an intervention right away. People tend to want to say, oh, call the doctor first. But, when you call the doctor's going to say, what was your assessment of that patient? And you can't say, hold on, let me go assess the patient. So assessment is the act of collecting information about the client. Then you're going to organize the information and determine its significance. It's the first phase in the nursing process. But assessment actually continues throughout all phases of the nursing process. So effective communication of assessment relies heavily on the presence of having a broad knowledge base and good critical thinking skills. So there's 2 types of data collection methods. That would be subjective and objective data collection. Subjective data includes what the patient reports their symptoms are. So how he or she views his or her health. So for example, the patient tells you that she has had a fever for 2 days, or the patient tells you um, their leg is hurting, or whatever. It's what the patient tells you. So the patient is the predominant or the primary source of subjective information. The patient usually knows better than anyone else what his or her health status may be. When we talk about objective data is observable, observable or measurable data. So an example of objective data is the nurse's observation that the patient's temperature is 101 degrees Fahrenheit. Objective data is obtained from, other sources like, or will be secondary sources like medical records, other healthcare team members, the nurse's own knowledge, the literature reviews. Those will be secondary sources. So what's observed, what's measurable, those would be objective data, whereas subjective is what the patient tells you. So a nursing diagnosis basically identifies potential health problems for a patient. So it's clinical judgment um, concerning a human response to a health condition or life process, or the vulnerability for that response by the individual, their family, a group, or even a community or whatnot. Now, nursing diagnosis is not the same as a medical diagnosis. Now, yes, they're both concerned with the patient's health status, but a medical diagnosis will identify the disease, um, whereas the nursing diagnosis will focus on the patient's response to that disease or life process or whatever. So there, the nursing diagnosis is focused on that person's response, whereas the medical diagnosis will identify what the disease is. For example, a medical diagnosis of pneumonia. That's a medical diagnosis. It actually identifies what that disease is. And so, or, another medical diagnosis might be diabetes mellitus, right? That's a medical diagnosis because it identifies that disease. Potential nursing diagnosis, how the patient responds to that disease could potentially be risk for unstable blood glucose, because that could be a potential response to the person with that particular disease. So we'll go over in a later chapter on how to exactly write a nursing diagnosis. And remember, I said the development of the nursing diagnosis is the sole responsibility of the registered nurse, but the LPN still needs to learn about it because they need to know why the RN develops the nursing diagnosis, and that way they can help suggest changes based on the patient's condition or whatnot. Okay, so the third phase in the nursing process is planning. So during this phase, uh, the nurse is going to prioritize the diagnoses that were developed, um, come up with some goals or outcomes. And when you're developing your goals, you need to, this whole thing should be done in conjunction with the patient and their family if the patient wants the family involved. But these are not the nurse's goals. These should be the patient goals. So you should be coming up with your goals in conjunction with the patient. Also, a part of the planning process is developing interventions. So, what interventions are you going to um, do to help you reach those goals? Um, so maybe the goal is, we talked about our diabetic patient. One of the goals might, if it's risk for unstable blood glucose, so one of the goals may be to maintain a stable glucose. And so an intervention for that, maybe we're going to teach our diabetic patient how to monitor their blood glucose levels. That would be an intervention. So we're going to prioritize our nursing diagnosis, develop goals, identify interventions to help us reach those goals, um, and, a, uh, and develop a written plan um, as well. And so our goals, we're going to develop short-term goals and we're going to develop long-term goals. Our short-term goals are going to be uh, about 7 to 10 days out or before the patient gets discharged if they're in a hospital. Our long-term goals, our long-term goals could be many weeks or even months. Um, to, if they have to, go to rehab or something like that. So our long-term goals are going to be, weeks or months out, whereas short-term is going to be 7 to 10 days or maybe even by the time the patient is discharged. Okay, so the implementation phase is the phase of the nursing process in which the plan is implemented. So the plan that we, set in place when we develop the interventions and all that. So now we're putting our plan into action. We're implementing our plan. So at a first glance, this phase may appear to be the simplest phase to carry out. But when you look at it more, that's not really true. During the implementation phase, you have to be able to think on your feet. So implementation of the plan requires you to have good critical thinking skills, psychomotor skills, communication skills, all those things. And so it also involves being able to continuously assess the situation, prioritize appropriately, and be able to make modifications when needed. You also have to have appropriate documentation of your interventions, and your patient's responses to those interventions should be documented as well. All right, so the fifth phase of the nursing process is evaluation. In the nursing process, evaluation is generally the determination of the effectiveness of the individual's, um, the patient's plan of care. So, was our plan effective? So we have to, go back. Did we achieve the goals that we set out to achieve? Um, if we did not achieve our goals, then we have to go back and look at it. So, are these goals still appropriate? Are these goals too lofty? Do we need to update and change our goals? Or are these goals appropriate, but our interventions weren't appropriate? So, do we need to go back and change our interventions to help us achieve those goals? So that's what we're looking at. Do we need to add any additional goals um, as well? So this is what we're looking at in the evaluation process. Okay, so critical thinking is defined as thinking that is purposeful, it's reasoned, and it's goal directed. So critical thinking is used to ensure the nursing process continues to be tailored to meet your patient's needs. Um, it prompts the nurse to thoroughly analyze information, consider multiple options, and make modifications as appropriate. So, therefore, hopefully, you can make some sound decisions. So, we need to be able to critically think as a nurse to make the best decisions to achieve the best outcomes for our patients. Um, we need to know what questions to ask, what things um, we should be looking at. And so you become a better critical thinker by the more experience you gain, the more education you gain. You'll become a better critical thinker. Because then you can think back, oh, I remember I had a patient with this diabetic ketoacidosis before and I had to do XYZ for that patient. So let me go and make sure I go assess these things or go ask these questions or go check these lab values or go do these things. So the more experience and more education I gain, the better critical thinker I will be able to become. And so clinical reasoning is just critical thinking in the clinical setting. So, like I said, to be effective critical thinking, or you become better at critical thinking, the more experience and the more education you gain. However, there are some, particular skills that you do need to have. to be an effective critical thinker. You need to be able to know how to read effectively. You need to know how to be able to write effectively, listen attentively. If you can't listen to your patient and what they're saying to you um, is going on or their needs, um, then you can't, be an effective critical thinker. You need to be able to effectively communicate with your patients as well. And so we're going to talk about developing your communication skills and things like that in a later chapter as well. So critical thinking is goes throughout the whole nursing process, whether we're talking about assessment, diagnosis, planning, implementation, or the evaluation, because we need to, like I said, you got to be able to ask the right questions. So if you're in assessment phase, what data do I need to collect? What data do I need to uh, share immediately with the doctor or the registered nurse or whoever? So we're talking about nursing diagnosis. How do I analyze this information? How do I prioritize this information? Same thing with planning. Based on the nursing diagnosis, what um, uh, what would be good goals I could share with my patient to try to establish? What would be some interventions? I don't know what interventions. If I'm not a good critical thinker, I don't know what interventions could possibly help this person, and then implementing it. Like I said, you're constantly assessing it and thinking as you're implementing things. How do I do this appropriately? Evaluation, um, evaluating whether the goals were met or not. So, being a critical thinker is important throughout the entire nursing process in all 5 phases. Which of the following is an example of a nurse's statement that reflects using the scientific method in the nursing process? The answer is 4. The patient reports more pain than yesterday and her blood pressure is elevated. So the reason being, reporting more pain than yesterday and elevated blood pressure reflects using the scientific method in the nursing process, because the nurse identified a problem of pain, hypothesized that it was greater than the day before. Um, you'd have to do your pain assessment to know if it was greater than before. Collected the data to evaluate its reality. So, ask the, meaning you had to ask the patient what their pain level was, or whatever scale you use. Believing that the patient is depressed or thinking something is wrong reflects intuition, and speaking with the husband reflects information gathering, which may be used in um, diagnostic reasoning. Okay, so these are just objectives for the next part of the chapter. Okay, so prioritizing your nursing diagnosis and your interventions is a decision-making process. And so you got to consider um, whether the issue is life-threatening or not, the healthcare setting, the available resources, patient preferences, are just a few little things you might consider when you're prioritizing. Um, they can make a significant impact when you are prioritizing your diagnoses and your interventions. So you're going to divide them into high priority versus medium priority versus low priority. So your high priority are going to be things that are life-threatening problems. For example, I can't breathe. I've got something lodged in my throat now. That's a high priority. You have to tend to that immediately, right? Medium priority are problems that threaten a person's health or coping ability. So, um, I could tend to my high priorities first and then get to them quickly after that would be medium priority. And then the low priority ones are problems that do not have a major effect on the person, um, if not attended to that day or even that week. They don't have really a major effect. And just like with our critical thinking, the more experience and knowledge you gain, the better you will be when it comes to prioritizing your tasks. Prioritizing patient problems is usually based on the adaptation of Maslow's hierarchy of needs. So if you remember Maslow's hierarchy of needs, that bottom layer is our physiological needs. So air, water, food, elimination, things like that. Then we move up to safety and security. Then it's love and belonging. Then it's self esteem. And then that top layer is self actualization. So if that bottom layer is not met, you're not motivated to move to the next layer. And so that's how, if I can't breathe, I can't focus on you teaching me about something else, right? So that's how we're going to prioritize. So let's give an example. So if you have a post-op patient that has been stable for the past 24 hours and needs to have vital signs checked versus checking the blood glucose and administering insulin for a patient with diabetes, which do you do first? So the first thing you're going to do is check that blood glucose and administer insulin for the patient with diabetes, because we need to ensure that their blood glucose levels are stable. That person who's post-op 24 hours, who's post-op and their vital signs have been stable for 24 hours, they're stable right now. So let's tend to the person that could potentially be unstable. When we're prioritizing tasks, we want to make sure we consider things like what will happen if the task is not done on time. So if we don't get that blood glucose and insulin done on time, what could happen to that patient? The stability of the patient. If the patient is stable, we could tend to somebody that's unstable first. The amount of time to perform the task. How much time is this going to take me? The availability of help. I could have a coccyx wound for a large individual that I can't do by myself because I need somebody to hold the patient. So I got to wait until I can get somebody to help me to do it. Medication orders. Your medication orders these medications due at 9 a.m. And you follow your facility's policy on that. What's your window? Some facilities, it might be an hour before, hour after. So I have between 8 and 10 to get that 9 a.m. med administered. Some units, it might be different. It could be 30 minutes before, 30 minutes after. So make sure you're following your policies as far as that goes. Um, Unforeseen problems that could arise throughout the day. The primary care provider making rounds. So do I need to get certain tasks completed before that provider makes their rounds? So what's going on? What things, I need to consider those things when I'm prioritizing my tasks. And as I prioritize my tasks at the beginning of the day, but could be reassessing that throughout the day, because the person's condition could change throughout the day and cause me to have to change those priorities. So you need to organize your workload every day using those key priorities that we just discussed in the previous slide. So you need to write it out. Write out what your major tasks you got to accomplish, and you should be checking those off as you go through out the day. Be flexible um, throughout the day, because, like I said before, patients' conditions could change throughout the day, causing you to have to reprioritize things. Unexpected things can come up. What if you have a patient to code in the middle of the day, or a patient that falls in the middle of the day? So then you're changing and having to reorganize things. So be flexible. Evaluate, evaluate and reprioritize your work as you go along throughout the day based on what things are happening. And know when to ask for help. If you're feeling overwhelmed, um, if you're feeling overwhelmed, then ask your supervisor for help. Ask another nurse for help or whatever. Or you might need to delegate some tasks. What tasks can be delegated to your nursing assistants or whatnot? So making sure knowing when you need to ask for help as well. Okay, which of the following nursing actions is the best example of problem solving? So your answer here is going to be 3. So this is an example of the critical thinking strategy of problem solving. The nurse gathers information by using several different products, then uses this information to determine which will be best for the patient. So effective problem solving involves the examination of your alternatives. What are your alternatives? While requesting the IV team um, to solve a problem, there is a little critical thinking needed because it would be understood that the IV team would be called under these circumstances. Although calling the kitchen solves a problem, there is little critical thinking needed because it would be understood that the kitchen would be called under these circumstances. And calling for another pain medication ordered solves a problem, but there's little critical thinking needed because it would be understood that the provider would be called for a new drug order under these circumstances.